And thank you to all of you for joining us today for the Experiential Learning MPower Hour. This is our career speaker series. And we call it MPower Hour because we hope that it empowers you to start exploring your career path. Our hope is that you will gain a lot of knowledge today from one of our career speakers and maybe help you begin some of your next steps in that journey. In case we haven't met, I'm Mrs. Gentine. I'm your Experiential Learning Coordinator, and my role in the school is to create experiences for you to help you along this journey. So Career Speakers is just one of those experiences that we can put in place. So welcome today to all of you, all of our Mason students, for joining us. Mr. Reuter, our Mason Middle School Assistant Principal, and I are working together on this virtual series. So Mr. Reuter, I think you have a few things you want to tell us today before we get started.
Absolutely. Just a few protocols that will help our virtual meetings run a little bit more smoothly, which I'm noticing everybody's following directions really, really well. So we're going to mute microphones. So no offense if you forget and I happen to mute you during the meeting. It just helps with background noise. So you should see a little cross through your microphone if you're muted. Questions that come up throughout, we're going to utilize the chat. So in the top right of your screen, there's a little square with some lines through it. If you click on that, that'll open up the chat. And as questions come up, you can type those in there, and then we'll be able to cycle through those and be able to answer those throughout our presentation.
Great, thank you. Well, if you've ever considered a career in education, healthcare, counseling, or you're kind of teetering among all of the above, you might find that a child life specialist is the career for you. So I'm happy today to introduce you to a friend and our speaker, Heather Storey. Heather is a child life specialist at Children's Hospital right here in Cincinnati. So Heather, thank you so much for joining us today. We can't wait to hear all about your career journey.
Thank you so much to both of you for having me, and thanks students for being here and tuning in. I know that I love today, and I've gotten to do this a couple times now. I know this format's a little bit different, but I'm really excited that we are still able to be together. So I'm going to jump in. Like they said, feel free to ask questions and we'll get to them. As they introduced, I'm Heather Storey, and I work full-time as a certified child life specialist at Cincinnati Children's Hospital in the PICU, which stands for Pediatric Intensive Care. So child life, kind of a brief sentence that summarizes all that we do, is that we minimize stress and maximize coping for children within the hospital. So you guys are much more creative. So maybe take a second and in your mind think about, go back to, you probably all remember being in 6th grade. So pretend in your mind you're a 6th grader, and all of a sudden you kind of start feeling sick, and your parents take you to the emergency department, and there's a lot of people that rush in and they're touching you and doing different things, and you have no idea what's going on and who anybody is, and there are some tests they run that are a little bit painful. And then the next thing you hear is that you've been diagnosed with cancer or some type of other disease that sounds a little bit scary. And so my job then is, as Mrs. Gentine said, I get to be their teacher, I get to be their counselor, and I get to help them and their whole family through that entire experience. So I'm sure you can imagine being in 6th grade again and having just a lot of adults that all of a sudden you have to be around and you have to figure out what's going on. And I'm sure, hopefully, it would seem helpful if somebody was alongside of you to help to explain what's going on. So that's my role, is that when children come into the hospital, I get to be their teacher, I get to be their friend, I get to be their counselor, I get to be somebody who we get to have fun together and be a kid together inside of the hospital walls. And so that's my whole role. So let's back up a little bit. How did I get here, and what courses did I take? What school did I go to? And all of those questions that you guys are maybe thinking through now. So growing up, I always enjoyed being around kids. I think kids are really fun. I love that, especially young kids, their main language is play. So they like to play a lot. They learn through play. And that's really attractive and appealing to me. So in high school, always thought I'll probably be a teacher and, work within the classroom, and I'll probably love doing that. So I went off to college thinking that I would major in education, and I started to major in education. And thankfully, the school I went to, pretty quickly, they got me in the hospital and in front of a classroom of kids. And pretty quickly, I learned that that's not my strength, and that's okay. And I'm really thankful for all of the teachers you all have within the classrooms who are amazing teachers and can do that. Pretty quickly, I realized that I just want to work more one-on-one with kids, and I want to really get to know children individually, which I know your teachers, because they're such good teachers, they learn how to do that. But that was really difficult for me. So I wanted the opportunity again to work one-on-one with children. So I thought about a few different things. I thought about things like being a school therapist and other things like that. But the other thing that I really loved was I always kind of thought about being a nurse, but I didn't want to be someone who had to put needles into children and do different things like that. And again, I'm really thankful that there are people who do that. So I didn't really know what to do, and I was a little bit confused. And this was even after high school and throughout college. I wasn't sure what I should do with the different things that I really felt I was strong in. So thankfully, I met somebody in college who kind of mentored me. She was called my RD, my resident director. And I definitely think it's so important to find adults who will point out your strengths and maybe even point out your weaknesses and say, yeah, maybe that's not for you, but let's figure out what is for you. So I met with her a lot of different times throughout college and kind of talked about what I liked and what I didn't like, and that I absolutely love working with people, that I love working with children, that I do have interest in the medical field, but also I didn't want to go to school for a really long time to become a doctor. So she had actually told me about somebody she knew who was a child life specialist at the time at Riley Children's in Indiana. And I was actually doing my undergrad in Indiana. And at the time, I had switched from education to psychology and sociology because I knew at least I could take time and learn about child development and study just things about people, even though I wasn't really sure what I wanted to do. So I reached out to this person that she knew who was a child life specialist, and she allowed me to come and spend a day with her and see what she did. And so quickly I fell in love with what she did, because I would see a child come in who was really afraid and really scared and not coping well with the things that they had to go through. And after they spent time with her and she used her background in child development to teach them what was going on in the hospital and why the doctors and the nurses and the respiratory therapists, who all have amazing jobs as well, why they were doing what they had to do. And after they spent time with her, I saw these kids have just a sense of relief, and they had a way to cope, and they had different outlets, and they had built a trusted friend who was never going to have to be the one to poke and prod and cause any pain. So I so quickly fell in love with the job and knew that I wanted to then become a child life specialist. But my journey was a little bit different because, like I said, I didn't know that going into college, and I didn't really even know that until my last semester of college. So I graduated my undergrad in psychology and sociology, which did set me up with some really good skills to be on the right path to become a child life specialist. I then started volunteering a lot of hours out in Pittsburgh at Pittsburgh Children's Hospital, and then also did something called a practicum there, where I shadowed a lot of child life specialists and fell even more in love with the career. So from there, I had graduated college, but still didn't have everything I needed because, again, I just kind of figured it out a little bit later in the game, which was okay. And so I went on to get my master's in child life and healthcare administration, and that took 2 years. And during those classes, I learned a whole lot about becoming a child life specialist and got to do a lot more hands-on at Children's Hospital and do an internship there and learn from some of the best people who really set me up for success. But I will say that I really, to be honest, didn't love being a student, like in middle school and high school and even the beginning of college. But now I feel like every day I'm still a student and I'm still learning. And so I've been at Cincinnati Children's for 8 years in the pediatric intensive care. And something I really love about my job is that every day I feel like I am learning something new and encountering new things. So that's really exciting and really fun for me. So I'm going to kind of go through, they sent some questions, which I think were great questions. So I want to make sure I hit on some of those. So you might see me looking at my screen a little bit. So as far as classes in middle school and high school, I did take a psychology class in high school. And I will say that was one of my favorite classes. And I learned that, wow, I really, really like this information. And I could continue to sit in psychology classes and enjoy it, where that wasn't necessarily the case for me for like social studies or history or things like that. So any classes you can take that are psychology or sociology related or child development, if you have those types of courses offered in high school, those are great classes to take. Other activities that are really good to be involved in, and you all have such amazing opportunities now that maybe I didn't back when I was a student in high school, but the time that you can spend volunteering at Children's Hospital, also here in Cincinnati, you guys are at a great spot. I didn't really have a Children's Hospital close to where I grew up, so again, that was a little bit different too, but I know Cincinnati Children's has a ton of opportunities for students to be involved, to be junior volunteers during the summer, and that way you can kind of learn, do I like being in the hospital environment? Because that is part of the job, is that you have to be pretty comfortable being in a hospital and being around sick children. Other activities and things you can get involved in, there's a lot of summer camps, and if you all were interested in that, I can always send resources, but there's lots of summer camps to get involved with children who have some medical needs and need some camp counselors and different things like that. And again, part of my role is making sure that kids can still be kids even when they are sick and have some painful diseases. We still want them to experience summer camp and different things like that. So those are ways that you can definitely get involved. I think I kind of hit on how I figured out this career was for me. I know I loved working with children. I enjoyed being in the medical setting, and pretty quickly I just realized this was the perfect fit for me. Let's see, what else? What do I think my job will look like in 10 years? I hope it looks pretty similar. Like I said, I've been doing this for 8 years now, and I really enjoy my job, and I enjoy the difference that I think I get to make a little bit for these children and families, but I also get to know some really incredible families and siblings and patients who are so resilient and so strong and teach me a lot. So I'm hopeful that my career will still look like that in 10 years. But I will say it's been pretty neat. Recently, I've had some new opportunities to teach a few courses at NKU, and now actually where I went to school in Indiana, they're starting a child life program too, so I'm going to be teaching a course there. So hopefully in 10 years, I'll be doing that a little bit more. And again, I just really love this profession, and I'm really passionate about it. So I'm hopeful that in 10 years, I'll be advancing the career by making sure that people know about it and giving people the opportunity to get involved and maybe educate them in that way. Other occupations or majors that are maybe related to my job include, I'm so sorry, I'll hang on one second. Yes.
I want a snack.
You need to go sit down and watch the movie. So sorry. Other occupations would be things like physical therapy. We work really close with physical therapists, occupational therapists in the hospital setting. We also work really closely with our chaplains and our social workers. So some people do wonder what the difference between a child life specialist and a social worker and a chaplain are in the hospital. There's a lot of differences, but kind of the overarching difference is that a lot of times our social workers and our chaplains work primarily with the parents and the adults involved in the hospital. So they will make sure that parents have the resources they need financially, and even the material resources that they need in order to help their child go through a hospitalization, where we work a lot more hands-on with the patient themselves and with the siblings and the children that are involved in a hospitalization. A typical day for me, that's kind of a hard question. People ask that a lot, and that makes sense. People want to know what a typical day looks like. But like I said before, one of my favorite things about being a child life specialist is that every day looks really different. And so every day I go into the hospital and I try to be involved in rounds. And rounds are when the doctors and the nurses and anybody involved in the care of the patient go around room to room and talk about what the patient's day is going to look like. So I try to be involved in that and find out what procedures my patients are going to be having done and maybe what different difficulties they might be facing that day. And then I do my best to make individualized plans for those patients and come up with creative ways that we can help a patient get through that day. So a lot of my day is spent doing preparation and support for procedures. And so that means that before a child is to get a MRI done, I would go in and I'll have kind of a teaching book and I'll show them exactly everything they're going to see and even the things they're going to hear throughout that procedure. And we'll talk through maybe what sounds a little bit scary or what sounds easy. And for the things that are scary, what can we do to help you through that? So then I would support that procedure. So I would go with that patient to that procedure if they wanted me there. And I would provide some type of fun and distraction. Sometimes that's watching a show. Sometimes if they're a little bit younger, that's playing I Spy and blowing bubbles and pinwheels and making it as easy for them as it can be, even though some things can still be hard. I spend a lot of times with siblings of patients. So if you have a brother or sister and they came into the hospital and you were coming to visit them for the first time, you would meet a child life specialist, and that child life specialist would sit down with you and your family, and we would talk through why your brother or sister is in the hospital and what you can expect when you go back to the room. So we would show you pictures of what the room looks like, maybe what your brother or sister looks like if for some reason they look different than the last time you saw them. And then we would spend some time with you in the room and we would answer your questions and maybe provide you with some activities for you to do with your brother or sister in the hospital. Another part of my role working in the ICU is that, and this isn't every child life specialist, it kind of depends where you work. So that's something else that's neat about child life is you can figure out things you do or don't like about the hospital and work in a place that fits your strengths. But something I do is end of life care. And so unfortunately, if we do have children who are going to die because of a disease or a sickness or an accident, I'll work really closely with those patients and those families and provide a lot of support throughout that time. And we'll try to make that time as comfortable as possible. And we'll try to make sure that their brothers and sisters understand what's going on. And we provide a lot of support to those families. So that's another big part of my job in the area that I work in. So then some people will ask, like, man, what's it like when you go home? Or is it hard to go home and not think about those things? And that can be hard. And so I think it's really important, and you would learn this in school and spend a lot of time talking through how to take care of yourself emotionally and coming up with your own coping plans for when you go home after a hard day. So after 8 years of doing this, I think that I've figured out pretty well how to take care of myself and how to implement self-care. But there are days that are hard and that you really have to go home and take a little bit of time and to think about the day. And maybe some days I'll even journal about it for a little bit so that I can kind of release it and then go on with my day. But it can be hard to separate. It takes some time to learn how to do that, but it can be done, and it's really important that you do that. I think that's kind of all I have, but I don't know, Mrs. Gentine, should I go ahead and look at any questions that came through?
You know what? You. I did see a question about job shadowing, and so I'll just take a moment to, in case some of our students aren't familiar with it, we offer a lot of job shadowing and internships, not really internships in healthcare, but in some other areas. But we do offer some of those opportunities, as you can expect, because of confidentiality. They're a little more strategic than just calling someone and saying, hey, I have 6 people who want to shadow you for the next week. So students, if you're interested in shadowing, I would suggest that you watch your Schoology class groups for those opportunities when we schedule those. But I really love the way that you touched on experiences, and not just a specific experience, but volunteering and some of the other ways that you mentioned to create some of those experiences besides shadowing. But Heather, it's up to you. If you want to answer the questions now, that's fine. However you want to do it.
Sure, yeah, I can go through these, and then if you all have some more, because I just want to make sure I hit on the questions that you all have. So one of them says, were you scared of blood or needles? And if you were, did you still consider a different job like doctor or nurse in the medical field? So I've never really been necessarily scared of blood or needles. And this is a question I get pretty frequently about being a child life specialist. And even though I don't have to be the one to inject a needle or necessarily deal with those types of things, as I mentioned, part of my job is supporting procedures. So I do see those things happen. And I think that is something you do have to kind of be okay with, even though, again, you're not the nurse or the doctor. You will experience those things and see those things. To become a child life specialist, you have to do an internship. And so an internship is during your undergraduate or graduate, depending on the path that you took, you would do a 4-month internship. And during that time, you would really get to experience those things. And I have interns with me sometimes, and sometimes they do have just a hard time with those types of things, and maybe they didn't realize it. But we're able, during their internship, to work on those things. And so sometimes that's just exposing them to those things and coming up with their own coping plan. And sometimes too, after you're around it for a little bit, you become a little bit less scared. And so a lot of them just kind of naturally overcome that and become okay with it. So I don't want you to think you're never going to see those things, but I also don't want you to think just because you're maybe a little bit timid or afraid of those things right now that you couldn't become a child life specialist, but you do encounter those things. How old do you have to be a camp counselor at specific camps? That's a great question. So I think you probably have to be over 18 to be like a full-time counselor all by yourself, but we at Children's take people who are junior volunteers, and you would be paired with somebody who's a little bit older so that you could still get some volunteer hours and experience those things. Are the hours demanding, or do you have flexibility with them? That's a great question. So I think it, again, kind of depends where you work. So when I say that, I work in the intensive care unit, and I have a pretty set schedule. So right now, things are a little bit weird, like everybody is experiencing right now because of what's going on in the world. But typically, I work Monday through Friday, and I work pretty normal hours. So I work like 7 to 5:30. Because of my job and the type of work that I do, sometimes there are days that I'm there pretty late. So that's a little bit hard. But the nice part about it is if I'm there super late the next day, I can maybe be flexible and go in a little bit later or leave early the next day. But again, it really depends where you work. So some of my coworkers who work in the emergency department, they do more of a nursing schedule where they work 3 12-hour shifts. Some of my other colleagues who work in just like an outpatient clinic, they pretty much work 7 to 3:30 every day, Monday through Friday, and they never leave late because the appointments are done and they get to go home. So I think that's something really neat about child life, though. You can figure out what works for you and what works for your family at that time and kind of pick a spot that works for your schedule. Let me look here. I think Mrs. Gentine kind of touched on the shadowing, and so hopefully there'll be some types of opportunity in the future. But again, that junior volunteer spot is really great at Children's if you want to do that. So this is a good question. What are the disadvantages of your job, and what improvements would you like to see throughout your career? So the disadvantages probably is that emotional toll that it can take. You get pretty involved with people and get to know people pretty well. So it's hard, just like it would be hard to watch anybody in your family get sick and go through a hard time. Sometimes these patients really start to feel like some of the people I care about the most in my life. So it's hard, even if it's just a painful procedure, it can be really hard and really sad to watch a child go through something painful. So that's probably the biggest disadvantage, is that you see those things and it does make you a little bit sad. Whereas I feel like some other careers, all careers have different disadvantages, but maybe some other careers it's not as emotionally taxing. Maybe it's more physically taxing, which is a whole different thing. I wouldn't say that my job is necessarily physically taxing, but I think it can have some emotional disadvantages. And so what improvements would I like to see? I would like to learn just to continue to take care of myself and to figure out all of my self-care. I would like to be better at that. I also think that some disadvantages for some child life specialists that I hear about, I haven't necessarily encountered this, but I know that some different hospitals, I don't think this happens at Cincinnati Children's as much, but some people have a hard time gaining respect from nurses and doctors. So if your nurses and doctors don't fully understand what you do, they might not call you for certain things, or you might have a hard time just figuring out how to connect with patients and families, because we a lot of times rely on a nurse or a doctor to tell us what's going on so that we can provide the support we provide. So thankfully where I am, I haven't really run into that, but I'm on a lot of different like councils and internet chats where I know a lot of child life specialists do run into that. So I know for a lot of people, there's a lot of hope that child life will just become more known so that doctors and nurses, maybe even when they go to school, they hear about it and learn how great it is so that they want to take advantage of the opportunity. Because I mean, I tell my nurses and doctors all the time, and I think they believe it and see it firsthand, that a big part of our job too is to make their job easier. They have a lot of different tasks that they have to do, and so we're able to take some of that off of them by explaining procedures and different things to patients. How often gift and kind donations? Yeah, so we get a ton of donations at Cincinnati Children's Hospital, and we are so thankful. Every year we get to do, it's such a fun event. We do this thing called Jingle Bell Junction. So if you're a kid in the hospital and it's Christmas time, that can be really sad. But something really cool that we get to do is we make this, I mean, it's bigger than my house, this room that it's in. It is this huge toy store, and everything that's in this toy store are donations from people all over Cincinnati, and we are blown away by that every year. So it's brand new toys, and we get to give invitations to the families, and the parents get to come down and they get to Christmas shop just like they would if their kid wasn't in the hospital, and it's all free for them, which is awesome because it can be really expensive to be in the hospital. So they get to buy with these tickets toys for the patient and also for the patient's brother and sister. And so all of that is donation. And so I think the question is, how often do I work with that? And I don't really work with that a ton. Thankfully, we have a whole other department who all of our donations go through, but I do get to go down sometimes and pick up the donations and thank the families, and that's really, really fun. So yeah, thank you for all those donations. That's awesome. Any other questions or things that would be helpful to know?
Students, you can see the chat, like. Heather, this was amazing. You did a great job of not only defining your role, but also explaining the differences. You know, I myself have even had a tough time wrapping my mind around the difference between your position and social work. So that was a great explanation. I think I just saw another question or two come through.
Yes. I know you said you work in the ICU. What specialty do you think you work with the most? Yeah, so that's a good question. That's another thing I really love about the ICU is that because I'm in the ICU, I work with all different age patients. So right now, my youngest patient is 3 months old, and my oldest patient is 23 years old. So, but that's not always the case. So if you worked, I used to work at Johns Hopkins, and there, all of their outside of the ICU, it was all set up by age groups. So if you were a child life specialist on a certain unit, you would only work with certain ages. So I really like the ICU because I get to work with all ages and all different diagnoses or illnesses. And so that's a hard one to answer because It really depends. It kind of, right now in the winter time, we see a lot of kids with really, really hard respiratory diseases. But in the summertime, I work a lot more with like traumas and different accidents, just because kids are outside and playing and having fun and accidents happen. But it really depends. That's a great question. But you could work on a floor that had a specialty like hematology, oncology, and work only with kids who have cancer. Or you could work on our transplant, and you would work with kids who are getting liver and lung transplants and things like that. So it really depends where you work. But because I work in the ICU, there's not one specific diagnosis that I work with the most. Do I like working with a specific age or disease? I really like working with teenagers. I think it's just a really neat opportunity because they can understand the logic behind things, and we can have ongoing conversations, and they can really vocalize to me what's hard and what's helping. But it also is just really fun to work with all different ages. Let's see if there's any. I think that's, did I miss any? Oh, I didn't scroll down. There are more. When I work with patients that are a little hard to communicate with or cooperate with, what are some things you do to communicate with them? So if it's hard to communicate, there can be lots of different reasons it's hard to communicate. It can be challenging to communicate because of the procedures that they're going through. So if a child is unable to talk because they have different things going on medically, I can try to help figure out a way for them to communicate. So sometimes it's something simple like giving them a whiteboard that they can write to me or draw to me what's going on. I also make specialized, they're called communication sheets. So if I have a patient who isn't able to communicate, I'll take a board and I'll kind of Photoshop different pictures onto it so that maybe they can point to what would be helpful. And so I try to think about their age and what are things they would typically ask for, and we'll communicate in that way. We do have a lot of, if it's a language barrier, and that's why it's hard to communicate, we at Cincinnati Children's are really thankful to have a lot of different interpreters and different communications we can use. If there are other communication problems, some other people that I work really close with are speech pathologists, and so I can ask them to come in and help us and see if we can figure out the best way to communicate. So there are lots of different resources I use, but I try to really get to know the patient and know why it's hard for them to communicate, and then we can make a plan from there. The wage for my occupation, that's a good question. So I think I should have looked this up before I started. I think starting out, the wage, our salary, we are salary employees, so it's typically a salary and not necessarily an hourly rate, but I think the starting salary is probably around like 40 to 50,000 a year. And then you can kind of grow in that. So at Cincinnati Children's, we have something called advancement. And so when you start, you're a Child Life Specialist 1. And then as you continue to be there and maybe you do different research projects or involved in projects, you can apply to be a Child Life Specialist 2 and then a Child Life Specialist 3. And every time that you do that, you get a 10 to 20% raise. So that's the best way to kind of increase your raise. So it just kind of depends on your background and if you have a master's or you don't have a master's, what your starting rate would be. But I think it's probably now between like 40 to 50 to start. You work a set schedule. How is your schedule every day? Do you work with the same patients every day or different patients day to day? So my schedule is pretty set every day, and all of us as Child Life Specialists have set schedules. So unlike nurses who maybe only know their schedule like 3 weeks in advance, I know my schedule for the whole year. Again, like I said, there can be days that are just kind of long and hard, and I'll be there a little bit later, but overall my schedule's set. I know what holidays and what weekends I have to work, and I can plan my life around those things. In the ICU, we can have up to about 35 patients on any given day. And so I have the ability, if I wanted to see them all every day. I don't, because that's a lot of kids to try to see. So every week work with the same patients, and then obviously some will leave and some new ones will come in. But some days I'll see up to like 10 kids, and other days I might only see 2 kids. It just kind of depends who's having what done and who needs some support for me that day. But so it depends who I see every day. I think I've answered everything. Does anybody else have any questions?
Heather, I think we'll go ahead and wrap up. Do you see any other questions?
I don't.
Okay. Well, it is so obvious that you're doing what you love, and your family, your calming presence has to be such a welcome to your patients and your families. And man, what an occupation! And I'm sure that many of our students learned something new today. Maybe they didn't even realize that this career existed. And I love your pay it forward attitude, and trying to educate not just our students, but helping to advance the career. So good for you. Students, I also really enjoyed something that Heather said at the beginning. She was very transparent in acknowledging that she didn't really know what she wanted to do when she got out of high school. And she pursued some different things, and she pursued some different experiences. And so you don't have to have it all figured out. And even when you do think you have it figured out, it'll probably change anyway. So I really, we didn't discuss that at all, but I love that you brought that up, because I think that's some of the pressure that our students feel beginning as early as 7th grade, is figuring out, thinking that they have to have a plan all figured out, or all their classes figured out, or their future figured out. And that's not really the way it works. So I really appreciate the fact that you brought that up.
Absolutely.
Okay. I guess we will end for today. Heather, thank you so much for taking your day off to spend some time with us.
Oh, thank you guys for having me. It's always a pleasure.
Okay. Goodbye.
Bye.